Pamene yomwe mutapatsidwe, sankhani 8 kuti mulipire fees. Pitirizani posankha 1 yomwe ndi St. Fees. Kenako mudzafunsidwa kuti mulowetse admissions number. Kuchoka apo, mudzaona sukulu yomwe mufuna kulipira komanso dzina la ophunzira. Onetsetsani kuti zonse ndi zolondola. Pitirirani ndi kuyika ndalama zomwe mufuna kulipira. Lembani pini yanu ya Airtel Money kuti muvomereze kulipira. Ndipo nthawi yomweyo mudzalandira SMS yotsimikiza kuti zatheka.
Tired of smell, overflowing toilets, constant emptying, and high maintenance costs? Introducing
It's time for news on Luntha Television with me, Charity Chalanga. First, let's have a look at the top stories.
Vatican rules out Pope Leo XIV visit to United States in 2026. Stakeholders urge President Mutharika to tackle low wages, high prices and education reforms in highly anticipated SONA. Government assures the nation of food security amid relief support. And in other news, Kenya to confront Russia over unacceptable use of its nationals in combat.
We do have the details to these and many other stories, so stay tuned. Pope Leo XIV will not travel to the United States in 2026, the Director of the Holy See Press Office, Matteo Bruni, said Sunday, denying circulating reports that the Pontiff might make an apostolic trip to his native country. A U.S. visit had been anticipated by some American Catholics ahead of the country's 250th anniversary of independence on July 4th, 2026. At the same time, a Pope travel elsewhere is taking shape. We have a Catholic News Agency report being read in our studio by Tandewe Mzumara.
Local church authorities in Africa have said Pope Leo will visit several countries on the continent, with Angola and Equatorial Guinea among the destinations publicly confirmed by local authorities, and Cameroon also widely anticipated as part of the itinerary, with timing broadly described after Easter. In South America, Peruvian bishops have said the Pope will visit the country where he previously served as a bishop later this year, with local church leaders pointing to a time frame in November or early December. A visit to Spain is also expected this summer, with Spanish church authorities indicating stops including Madrid, Barcelona, and the Canary Islands. Popes have visited the United States multiple times, beginning with Pope Paul VI's October 1965 trip, which included a visit to the United Nations. St. John Paul II traveled to the United States on several occasions, first visiting in October 1979 with stops in Boston, New York, Philadelphia, Des Moines, Iowa, Chicago, and Washington, D.C., where he met then-President Jimmy Carter. Among his later visits, he returned in 1995 for the 50th anniversary of the United Nations and made his final U.S. trip to St. Louis in 1999. Pope Benedict XVI also visited the United States, traveling in April 2008. The most recent pope to visit the United States was Pope Francis, who traveled there from September 22nd to the 27th in 2015. During the visit, he went to Washington, D.C., where he canonized Junipero Serra and addressed the United States Congress. He then traveled to New York, speaking at the United Nations General Assembly, before concluding the trip in Philadelphia, where he presided over events marking the close of the 8th Ward Meeting of Families.
Ahead of the State of the Nation address SONA by President Professor Arthur Mutharika, stakeholders including the Malawi Congress of Trade Unions, economic and education experts are calling on government to prioritize low wages, the rising cost of living, economic recovery and education reforms. President Mutharika is set to present the SONA this Friday at Parliament Building in Lilongwe. Among other issues, the stakeholders have expressed hope that government will use the upcoming budget to address low wages amid the rising cost of living. More details in this report, followed by Gift Kalonga.
Malawi Congress of Trade Unions, MCTU, Deputy Director Jesse Chingoma, has said the labor movement has high expectations in the upcoming budget, noting that Malawian workers continue to face serious hardships due to low wages and the rising cost of living. Chingoma added that government needs to urgently review workers' income to help reduce poverty, observing that Malawi has the lowest minimum wage in the SADC region and that most workers support extended families, making decent pay critical for improved livelihoods.
As a labor movement in Malawi, we have very high expectations in the upcoming budget.
Education expert Benedicto Kondowe said the president must show strong commitment to reforms that will transform education and support the attainment of Malawi 2063, emphasizing the role of education as a cornerstone for national development. Kondowe asked that the president should reaffirm support for free primary and secondary education, ensuring clear implementation plans and frameworks are in place to deliver quality education and avoid challenges experienced during previous rollouts. Economic expert Chris Mbukwa has advised President Mutharika to outline plans to stabilize prices of goods and services, stressing that controlling government expenditure and ensuring food availability are key to tackling inflation. Mbukwa asked that the SONA should also address challenges of low foreign exchange reserves and outline strategies for generating revenue, including whether the government will rely on borrowing or mobilizing domestic resources to finance essential programs.
Yeah, there are so many areas that people are expecting the president to address. But really the most important one is how are we going to make the economy to work again.
President Professor Arthur Mutharika is expected to deliver his State of National Address, SONA, on Friday, 13th February 2026. For Luntha News, this is Gift Kalonga.
Chief Secretary to the government, Dr. Justin Saidi, has expressed optimism that Malawi will not experience food shortages, citing continued humanitarian support from Zimbabwe and other stakeholders following the declaration of a national disaster due to prolonged dry spells. Saidi made the remarks on Tuesday in Lilongwe when the government of Zimbabwe officially handed over the second consignment of relief items to support households affected by food insecurity. More details in this report read by Patrick Popper.
In his remarks, Saidi thanked the people of Zimbabwe and President Emerson Mnangagwa for what he described as a consistent and reliable support, noting that Zimbabwe has now delivered relief assistance to Malawi for the second time, with a third consignment already pledged. He said the latest donation includes 370 metric tons of maize, adding to area suppliers of foodstuffs and blankets delivered in January this year. Saidi said the continued inflow of humanitarian assistance from Zimbabwe, local companies and financial institutions is a clear sign of confidence in the Malawian government, especially after the president declared a state of disaster affecting all 28 districts and the 4 cities. He assured Malawians that the relief items will be distributed to the intended beneficiaries, stressing that government systems are in place to ensure transparency and fairness.
We want to express our gratitude to the people of Zimbabwe through their state president, Emmerson Mnangagwa, for this support. The way we see Zimbabwe has come to stay in terms of supporting us. They came on 27th January, they gave us foodstuffs, blankets, and the rest. And today they have come with 370 tons of maize. And they are telling us they are coming for the third time.
Zimbabwean ambassador to Malawi, Nancy Nsangweme, said the donation reflects strong neighborly ties between the two countries, describing Malawi and Zimbabwe as one family that must share resources in times of need.
We already said it last time when we donated the first consignment that we've got a second in the third. So this is the second consignment because we also calculated and realized if we bring so much, it will take you for a while.
The donation follows the declaration of state of disaster by President Arthur Peter Mutharika in October 2025.
NICE Trust 2025 General Election Long-Term Observation Report has concluded that the September 16th polls were generally free, fair and credible. Releasing the report in Lilongwe today, the National Initiative for Civic Education NICE Trust Executive Director Grey Kalindekafe said the elections were peaceful and competitive and broadly reflected the will of Malawian voters. However, he noted that long-standing structural weaknesses continue to hinder democratic accountability and effective political representation. Kalindekafe further said the elections underscored the central role of voting in sustaining Malawi's representative democracy despite ongoing challenges such as poor internal party democracy, vote buying, the growing influence of money in politics, voter apathy, misinformation, and an increase in independent candidates. Kalindekafe explains.
As I've indicated today, NICE is releasing its final long-term observation report for the 2025 election. We have released the partial reports before for the polling, for registration, but this is the final, which is covering the entire electoral cycle, and it's meant to contribute to public dialogue and also to contribute to a number of electoral reforms. The report is emphasizing that the 2025 elections were done in a very transparent, accountable, inclusive, professional and accessible manner, and the elections represented the will of the people of Malawi.
Government has reaffirmed its commitment towards bringing health services close to local communities. Minister of Health and Sanitation Madalitso Baloyi MP was speaking on Tuesday in Balaka District as she presided over the official commissioning of Kwisa Health Center. Baloyi said government is committed to providing quality health services, warning health personnel to avoid theft. Andrew Nandolo has filed this report.
Construction of Kwisa Health Center began in 2013 during the tenure of then area member of parliament and now First Lady Gertrude Professor Mutharika. 12 years later, with the support from the Health Sector Joint Fund comprising Germany, the United Kingdom and Norway, the facility has been officially commissioned. Speaking at the event, Minister of Health Madalitso Baloyi thanked the Health Sector Joint Fund through the German Embassy for their support, noting that the development aligns with the government's commitment to achieving universal health coverage. She further revealed that plans are underway to upgrade Kwisa Health Center into rural hospital.
This is one of the health centers that within Balaka, it is operated by a doctor. This is the direction that we are taking as Ministry of Health. We want to make sure that we move services closer to the people as guided by our Health Sector Strategic Plan 3 that we are using. So this is a very good development here, and we want to decongest Balaka District Hospital, and this is one way of doing it. It has been constructed with support from our partners, Germany, UK, and also Norway. So we are very grateful. Today is really a happy day here. So I've warned the workers here to say we don't want the equipment, high standard equipment that is here, to be stolen by health workers, and at the same time we don't want the spirit where health workers are shouting at the patient. We want to make sure that the patient is at the center of service delivery, and that is what we are advocating within the ministry and elsewhere.
Of cooperation at the German embassy said her team would be pleased to see the government, local council and the entire community take full responsibility for maintaining the facility to ensure it remains accessible to future generations.
So we are very excited, Honourable Minister, today. As the Partners in the Health Services Joint Fund, we look forward to the ministry and the local authorities to take full responsibility of the investment we have done, to ensure that there is always enough resources for the maintenance of the infrastructure, also improved asset management, infrastructure and equipment upkeep. And obviously also what's a health center without the qualified personnel? We also look forward for always sufficient deployment to the health center so that our investment is meant to last for the next decades and generations to come.
The opening of Kwisa Health Center has created hopes for the decongestion of Balaka District Hospital. The construction of the facility has cost close to 2.1 billion Malawi kwacha. Reporting from Balaka, this is Andrew Nandolo.
You are watching news on Luntha television. Let's have a reminder of the top stories.
Vatican rules out Pope Leo XIV visit to United States in 2026. Stakeholders urge President Mutharika to tackle low wages, high prices and education reforms in highly anticipated SONA. Government assures the nation of food security amid relief support. And in other news, Kenya to confront Russia over unacceptable use of its nationals in combat.
Moving on with the news, the Lilongwe District Health Office has disclosed that the district has gone for at least a month without recording any suspected or confirmed cholera cases. Confirming the development, spokesperson for Lilongwe District Health Office, Richard Mvula, however, underlined the importance for continued adherence to preventive measures, including hygiene. Constance Kantemini has more in this report.
Spokesperson for Lilongwe District Health Office, Richard Mvula, said the district is currently free from cholera outbreak that has seen 2 people died countrywide since its resurgence in December 2025. The development marks at least a month without any suspected or confirmed infections in the district. Mvula has attributed the positive stride to as a result of health promotion activities that the office is undertaking.
So far, we do not have any suspected cases or any confirmed cholera cases at the moment. We just have to maintain the health promotion in terms of messaging and sensitization to the community, but also encouraging community members to uphold the hygiene and sanitation standards so that they do not get the disease. But also, we are still monitoring and doing environmental surveillance in all the hotspots so that we finish with this year with no any other additional cases.
As of Monday, Malawi has recorded a cumulative total of 79 confirmed cholera cases. Every year, the country grapples with cholera outbreak, while experts describing it as a manifestation of poor implementation of response plans in the health sector. Government has been encouraging people to practice hygiene in order to address cholera outbreaks. For Luntha News in Lilongwe, this is Constance Kamtemen.
The Center for Social Research (CSR) has disclosed that shortages of medicines and medical supplies in the country are partly caused by theft and mismanagement within public health facilities. According to the research findings, some health workers are directly involved in stealing drugs from hospitals, significantly contributing to the erratic availability of medicines and medical supplies across the country. The study notes that despite being professionals entrusted with upholding high ethical standards, some healthcare workers have failed to live by example, undermining efforts to ensure consistent access to essential medicines for patients. Emmanuel Georgia reports.
Commenting on the findings, Chairperson for Human Rights Resource for Haiti, Solomon Chomba, said it would be naive to dismiss allegations of drug theft and embezzlement in health sectors, describing the problem as the real and long-standing. However, Chomba emphasized that health workers are not the only contributors to drug shortages, noting that weaknesses in procurement system, supply chain, and storage facilities also play a critical role in the loss of the medicines.
Well, I would say I wouldn't dispute that report, because I think we're all aware that we've been receiving a lot of cases from different hospitals across the country regarding this issue of drug safety and hospital equipment safety. So I would say this is news, it's something that is there, and it's something that I think as a professional body, we have a duty to make sure that we discourage this kind of conduct, which is disadvantaging very innocent Malawians.
Health expert Sandra Mapemba has since commended UNIMA for the conducting of the research, saying it has helped to expose malpractice in public hospitals. She, however, described the situation as sad that professionals in the sector already struggling are contributing to challenges that worsen the crisis.
It's a sad development that this practice is still happening. We instituted a drugs committee to oversee such incidents, and they had clamped down on this drug sales. But as we see that I think the justice system or the penalties, we don't really see the outcomes of some of these penalties when they are brought to book.
Meanwhile, Human Resource for Haiti has called for a thorough review of the procurement process, strengthened supply chain management, and improved security of the medicines in the health facilities, saying addressing these gaps is a key to curbing drug theft and restoring public confidence in the health system. For Luntha News, this is Emmanuel Georgia.
Care Malawi, in partnership with World Bicycle Relief Buffalo Bicycles and with support from the European Union under the Nchito Bambande project, has today handed over 161 bicycles to project beneficiaries in Lilongwe, aimed at improving mobility and access to skills training among young people. During the handover ceremony, Care Malawi Country Director Pamela Kuali said mobility challenges has been one of the major barriers affecting youth participation in the program, with some dropping out due to having to travel long distances. Fales Chizombe has found this report.
Nchito Bambande project aims to train 672 certified mechanics, contributing to the wider objective of skilling over 5,000 young Malawians in vital vocations including digital, agri-TVET, welding and fabrication, among others. According to Care Malawi Country Director Pamela Kuali, the bicycles will ease movement and help beneficiaries remain committed to their education and economic activities.
As Care Malawi, we are the lead for this project that is funded by the European Union. It's called Nchito Bambande. It's a youth skilling program, so we are focusing on livelihoods and skills to enable the youth transition into employment.
In his sentiments, Buffalo Bicycles Country Director Anthony Kenneth said the organization is committed to supporting young people, not only with mobility but also with mechanical skills and tools to help them maintain and repair the bicycles, thereby extending their lifespan.
As Buffalo Bicycles in Malawi,
we're looking to grow a bicycle ecosystem. So that means the support system around the bicycles that we visible number. And what we found is that you need to train mechanics to ensure that the bicycles last longer.
Meanwhile, acting registrar in the Ministry of Labour's Department of Technical and Vocational Training, Anderson Lajab, has hailed the initiative, saying it aligns with government efforts to equip youths with practical skills for self-reliance.
It is very, very pleasing. Emphasis on training the youths to be fully equipped, such that they shouldn't be dependent to other people. We are very, very happy.
One of the beneficiaries, Matilda Piri, thanked the Nchito Mbambande project for the support, saying the bicycles will make it easier for her to travel to school and pursue her studies without difficulty. Nchito Mbambande project targets 5,300 vulnerable young people and equip them with market-relevant technical, digital and green skills to enhance their transition into employment and self-employment. The project works through partnerships with technical training institutions and innovations hubs, including MHub and Company Missionaries Institute Limited, and promotes gender-responsive approaches aligned with Malawi 2063. Fales Chizombe reporting for Luntha News.
And in sports, the chairperson of the Malawi National Council of Sports MNCS Board, Jim Kalua, has reaffirmed the commitment to improve sports infrastructure across the country to meet acceptable standards. Kalua has noted that the development of quality sports facilities is key to the growth and the professionalism of various sporting disciplines in Malawi. He made the remarks on Tuesday during an inspection tour of the Kamozo Institute for Sports in Lilongwe. Patrick Pupa with the details.
The visit was aimed at assessing the current state of the facilities and identifying areas that require urgent improvement to better serve athletes and the general public. During the tour, Kalua expressed concern over the condition of the main hall, which is used for hosting various events but currently lacks adequate seating. He noted that such challenges affect the smooth hosting of the sporting and social events and called for timely interventions to address the gaps. Kalua also inspected several indoor sports courts at the institute, including those used for netball, volleyball, and basketball. He emphasized the importance of maintaining and upgrading these facilities to ensure athletes train and compete in safe and conducive environments.
I think I'm very concerned. You could see that is how the infrastructure inside is. That is for commercial purposes. But we have seen it's still that is in need to fix this and put this that is to use. But there's a lot of potential. And where I was also concerned, more especially something to pass all over and that's very dangerous. And immediately.
Kalua further revealed that similar inspection visits will be extended to other major cities, including Luntha and Mzuzu. Kalua said the initiative is part of the Malawi National Council of Sports broader plan to enhance sports infrastructure nationwide and promote the development of different sporting codes across the country. For Luntha News, this is Patrick Pupa.
And in news across the borders, Kenya says it will talk to Russia over growing reports that its citizens are being recruited to fight in the war in Ukraine. Speaking to the BBC, Foreign Minister Musalia Mudavadi called the practice unacceptable and clandestine and said Nairobi had shut down illegal recruiters and would urge Moscow to sign a deal banning the conscription of Kenyan soldiers. We have a BBC reporter read in our studio by Tandewe Mzomara.
The Kenyan government estimates that around 200 of its nations have been recruited to fight for Russia. The exact number remains unclear, as Nairobi maintains that none of them traveled through official channels. Mudavadi has told the BBC that Kenya's engagement with Russia will focus on curbing illegal recruitment practices including discussions on visa policy and bilateral labor agreements, excluding military conscription. He said the Kenyan authorities had closed more than 600 recruitment agencies suspected of duping Kenyans with promises of jobs overseas. So far, 27 Kenyans who had been fighting in Russia have been repatriated, he said, with authorities providing psychological care to address their trauma and radicalize them. It is not clear how many Kenyans have died fighting for Russian forces, and Russia has not formally addressed such reports. Relatives who have approached the Russian embassy in Nairobi for answers report being turned away.
With that item, we've also come to the end of our today's bulletin, but let's have a recap of the top stories before we go.
Vatican rules out Pope Leo XIV visit to United States in 2026. Stakeholders urge President Mutharika to tackle low wages, high prices and education reforms in highly anticipated SONA. Government assures the nation of food security amid relief support. And in other news, Kenya to confront Russia over unacceptable use of its nationals in combat.
You have been with me, Charity Chilanga. Thanks for the pleasure of your company. Goodbye.